Hey, two birds headed our way. Need a hand?
That's the rumor. Santos, trauma incoming. Grab a gown. You can assist Dr. Langdon.
Ed.
Don't think so. I need to find my son.
We'll find him for you, but we need to take care of you first.
Pericardium's clear, no fluid in Morrison's.
Move both arms, wiggle. Not yet. Let's go posterior lateral, look for fluid first.
Traumatic pneumothorax, we should prep the chest.
Not necessarily. He's hemodynamically stable.
Okay. Does that look like some fluid there?
Hard to say for sure.
Okay, he's tachycardic pneumothorax. He needs a chest tube.
BP and SATs are fine. We can wait for CT. If it's small, it'll resolve on its own. We observe and re-image.
I agree. He's stable for now. Let's wait for the scan, Dr. Santos.
Okay, let's order CT chest, abdomen, pelvis, and X-ray left hand.
Whoa, major degloving.
Focus on the primary.
Dr. Langdon's correct. We need to log roll him.
Okay, how about another 4 morphine?
I grabbed Zach's arm and I tried to hold on to the sides, but my hand slipped and my ring got stuck. My finger was ripping off and I lost him.
We can numb up your finger as soon as we gauge the extent of the injury.
You can cut the damn thing off for all I care. I just need to find Zach.
Okay, do you feel anything here?
I am the show, Dr. Langdon. You're the warm-up act.
Knew somebody missed me.
Mr. Foster suffered a degloving injury of the ring finger. Stable pneumothorax awaiting imaging.
Hello, sir. I'm Dr. Garcia.
Tess?
Seriously? That's a med student question. We're a teaching hospital. It's always good to review.
Flexor digitorum superficialis is intact as it inserts on the...
Let's wait for the CT. I'll be next door.
Langdon. Mel's sister's been asking for you.
And the rest of you, the last time I checked, the ED is a shit show, so let's all get back to work, huh?
Picture.
Okay, thanks. Radiologist reports a 25% pneumothorax.
Is that bad?
That is a partially collapsed lung that needs treatment.
I can put in a chest tube.
He doesn't need a chest tube.
Okay, what do you want, a pigtail catheter?
I was thinking a Thoravent.
What? Why? It's not a bad idea. No need for well suction.
If Hannah can operate today, he can go home tomorrow with a Thoravent.
You can learn a lot from your senior residents.
I'm happy to teach Dr. Santos.
Pull up the trachea between your thumb and middle finger. Vertical incision right over the trachea. Vertical, not horizontal, or you transect the trachea and cut the jugular vein. Check the CO2.
Sounds coming up in the 80s.
Bilateral breath sounds, and tidal CO2 is 70. That's crazy high.
It'll come down. Tie down the tube, control all the bleeders. Spray an Epivepi on a stack of 4x4s.
Okay, sats are up to the 90s. Good, CO2's in the 50s. Good heart rate.
You forgot the last step. Change your underwear.
How many of these you done?
First one.
You serious? What about you?
None.
I practiced in the sim lab when I was at Stanford.
What'd I miss?
All the fun.
Slash trach.
Seriously?
Fractured larynx, couldn't oxygenate, couldn't ventilate.
Use a meat cleaver on this kid?
ENT can revise the trach in the OR.
They'll be thrilled to clean up your mess.
Or maybe they'll thank us for not letting him die. Ben, our slash trach kid from the water park, had some purposeful movement in pre-op.
That's a good sign. Take the win.
We need to talk
We are talking.
in private. What the hell was that with Samara earlier?
How you two getting along?
I can play nice for another 2 hours.
Where are we? Kidney stone patient's not obstructed, just waiting on med. Labs and x-rays are way behind, but our golden girls are getting their steps in.
Does Robbie usually leave as soon as his shift ends, or does he like to stick around for all the handoffs to night shift?
Depends, but he's usually pretty good about getting out of here.
Heart rate is 22 in 10 seconds. That's 132.
Do you know his weight?
No.
Joy, the Proslo?
The what?
The Proslo tape gives us all the drug doses based on length. By the time I found him, I couldn't wake him up. How long was he in there? Maybe 15 minutes or 20.
And the car was just unlocked.
Wait for RT.
When the temperature is this high, the muscles can lose their strength. So we're going to help him breathe with a tube.
Rectal temp is 105.5. Heat stroke.
Ice packs to the groin and axilla.
See if we have an Arctic sun that's not in use. We need all the ice we can get.
Concerned about his brain.
Great, let's get him.
And pupils are minimally reactive.
Going.
All encouraging signs. Any luck getting a lawyer for our detainee?
No.
Keep me posted.
Yeah.
I just don't buy it. She lost her kid at home. Plus, she just looks guilty. Has anyone seen her cry?
People don't always respond to trauma the way you expect them to. Stay focused on the kid.
We're lightening up his sedation to see if he has any purposeful movement. If so, that will be an encouraging sign.
He'll be back to normal.
There's no certainty as to how much recovery Michael will have.
What's going on?
I found her outside wandering into the street. She almost got hit by a truck. I think it was intentional.
Across the line.
I told Nurse Kim not to let her out of her sight. We need to call a 302 and observe her.
Danger to self?
Is she gonna be able to see her kid?
No, if she's on an involuntary cycle.
Well, what happens if he's ready to be discharged before she is?
Does she have a partner or a relative we can call?
I can find out.
Why don't you and I talk to her together?
Sure. I just need to check on a patient and I will meet you there.
I tried to get him to help me in the garden, but he just wanted to ride his trike. So I let him. Every time I looked over, he was just riding.
Give herself. I've noticed some tension between you and Dr. Santos. You two have history?
I'm gonna talk to her. I just haven't found the right time.
Good. Do.
Has her husband arrived yet?
Yeah, but he went straight upstairs.
Really?
He may have just wanted to see his child first. Let's not jump to conclusions. Dr. Robbie, can I have a word?
Shoot.
In private.
Maybe we're gonna start to talk. He is the best of the best, and I would put it up against any emergency department in the country. And it is going to be yours to fuck up, so don't fuck it up.
Nitrates.
Dose?
BP 198 over 132, pulse 120, pulse ox only 85.
Good BP. Let's start at 400 mics per minute for 2 to 5 minutes.
I was asking Dr. Javadi.
Don't you always start low with nitro, then titrate up?
In flash pulmonary edema, we do the opposite.
What do you really up the BiPAP to 20 on 10?
We could try phlebotomy, decrease the fluid burden on the lungs.
Old school, but my bite.
The potassium intracellular?
Exactly. 10 units, amputee 50.
Start with 5 milligrams of nebulized albuterol. It'll shift some potassium and help his breathing.
He's at risk for arrhythmias.
No peaked T waves, no QRS widening. Insulin puts him at risk for hypoglycemia. And you tie up nurses with frequent AccuChecks.
Dr. Al-Hashimi is right. The nebs will hold them over until dialysis gets here. You got this.
All good in here?
Yep.
Is that the mom of the heat stroke?
Yeah.
Do you believe it was just an accident?
Does it matter?
As a doctor, no. As a mom,
Sometimes I can't tell if motherhood has made me more understanding or more judgmental.
Boy just got his permit last week. Felt like I was living in...
I can't believe Pine Ridge closed. When did that happen?
I read about it a few months ago. Medicare spending cuts.
Are there any other emergency rooms in the area?
Nope. It's gonna be a long way to drive for folks out where we live.
Mr. House, you'll need to stay here a few hours. Get you tuned up.
Yeah, I know the drill.
Westbridge and Good Dominion have settled their cyber dispute.
They paid the ransom?
Yeah. Our IT department is confident in our defenses, so they will be rebooting everything soon. slowly but surely.
Okay, so when everything comes back on, all the residents have to do is scan all the completed paper charts and digitize them into the patient's EHRs before they go?
I'm never getting out of this place. This means you're clear for takeoff. Nothing here we can't handle with night shift coming in.
Yeah, right. Free to go.